Can you talk a little bit about the different types of mutations and, how they actually work? What's causing the cancer to grow?
Sure. And here I use the analogy of a light switch for my patients. For many of the genes that we're looking at, these are present in normal cells. And when there's a genetic mutation in them, and at specific points, it changes the function of the light switch. So normally these are under control. Turn it on, it tells the cell to grow. If you turn the light switch off, it says stop growing. The problem with these genetic mutations is that the change results in the light switch constantly being on. So it changes the function of that particular gene. And so the cell is constantly being told to grow, grow, grow. Now we can take advantage of that therapeutically by delivering targeted medicines that actually shut off that signal. But it's just like a lock and a key. You have to have the right genetic change and pair it with the right therapy.
Dr. Poole, you're a pathologist, and I'd like you to speak a little bit about what your role is in this whole tumor testing process.
We take tissue that's removed from some surgical procedure. It could be a biopsy or a surgical resection of the tumor, and then look at it under the microscope to try to look at different attributes of the tumor in order to try to put it in a group of tumors that we know from previous history from other patients how they will behave or how they will respond to certain treatments.
Now we're going to take a few questions from our audience and try and address some that we received online.
My question is, do patients have to be treated at big hospitals to get this type of testing?
Yeah, so the answer is no. That this is something that should be done regardless of where patients actually are getting treated. Now, the extent of the tumor panels, the gene panels, can vary from institution to institution, but the core genetic changes with FDA-approved therapies, someone should be getting access to that regardless of where they're getting treated.
We're going to take a few questions from our Facebook audience. The first question is, how does a patient know if their tumor has had next-generation sequencing?
I think that's a challenge, especially because this information may reside in other places. So, for example, sometimes we have patients referred to our institution and we don't really know what testing they've had previously. So again, it goes back to communicating with the oncologists or surgeons to find out what has been done so far. So we don't reduplicate testing, but also if testing hasn't been done, that we acquire the appropriate tissue.